Let's take a moment to learn about carbohydrate ratio and how to use short-acting insulin. Your doctor has given you a carbohydrate ratio. Carbohydrate ratio means how many units of short-acting insulin cover this amount of carbohydrates. For example, you might have a ratio of 1 to 10, which means 1 unit of short-acting insulin covers 10 grams of carbohydrates. How do you use that in real life? You'll take your Aspart or Lispro or Novolog or Humalog. Those are all short-acting insulins, and it's usually in the form of a pen. And about 10 to 15 minutes before you eat your meal, you will administer the short-acting insulin in the appropriate amount of the carbohydrates you're eating. For example, let's say you're about to eat a sandwich. To know how much insulin to take, you need to know how much carbohydrates are in that sandwich. Again, we're not talking about calories or sugar or fat or whether or not it's healthy. We're talking about just carbohydrate count. You will look at the nutritional facts of that which you are eating. You need to look under carbohydrates and you need to look at the serving size. For example, if you're about to make a sandwich, you look at the nutritional facts and you look at the carbohydrate count for each slice of bread. If each slice is about 15 grams of carbohydrates and you're using 2 slices of bread to make a sandwich, you are consuming 30 grams of carbohydrates. If you're putting in there turkey, cheese, tomatoes, mayonnaise, all of these things are actually 0 carbs. So your sandwich is still just 15 grams per slice, which is a total of 30 grams of carbs. If you're using a ratio of 1 unit for every 10 grams of carbs, then for the 30 grams of carbs, you need 3 units of short-acting insulin. And you would administer that about 5 to 15 minutes before your meal. And then you have the right amount of short-acting insulin to cover that meal, specifically the carbohydrates in that meal.